Welcome to Dr. G at the Heart of Healthcare, a special bonus episode for Breast Cancer Awareness Month. I'm wearing my pink over here, and we have a special guest, Dr. Renee Drolet. My French accent, did that go well?
Yeah.
She is a psychiatrist, a psycho-oncologist in the Bay Area, and she's going to help us understand what psycho-oncology is. Welcome to the show.
Yes, thank you, Dr. G. Thank you for having me. I'm very excited to be here today with you.
I am excited that to learn something new because I had no idea about this specialty, and perhaps, my
Mhm.
listeners don't even know about it. So let me first give you a little introduction, and I want to make sure that I touch on your expertise and your training.
Mhm.
You mentioned to me that you're from South Florida. You went to University of Miami undergrad and medical school, Chicago, Northwestern.
Yeah.
Let's see if I get it
Mhm.
right. And then medical school and at no, 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 residency at UCSF in psychiatry,
Yes.
right? And listeners, I really need you to know the difference between psychiatry and psychology. They are two different disciplines. So psychiatrists are doctors. They're either MDs or DOs, and that is something that is one of the core specialties of medicine. A psychologist is a different road. They can be doctors as well, like our president of the American Psychological Association is Dr. Tama Brandt, and she is a doctor, but that's of psychology. We are talking about psychiatry here, just so you know.
Mhm.
But anyway, thank you for being here. And could
Of
you tell
course.
us, like, how you chose this specialty? Like, let's start there.
hmm Yeah. So like you said, I did my psychiatry training at UCSF, and part of their training program offers a year-long training and learning opportunity with the Psycho-Oncology department at UCSF, the Helen Diller Cancer Center. And so as part of my training, I spent a year there. And I really enjoyed there's a collaborative nature in psycho-oncology, right? Working with oncologists, palliative care doctors. I really enjoyed the collaboration between like interdisciplinary, like across specialties to really help a population that uh, can be incredibly like vulnerable, and can be incredibly uh, like just a scary time in general. And so I decided to expand access to this type of care outside of the academic institution. Most psycho-oncology services are located, and this is just to kind of educate, are located within large academic institutions, like, for example, where I trained at UCSF. But there's limitations to um, the accessibility, right? So sometimes there's long wait lists to get access to this level of care. And sometimes there's uh, not enough providers to provide this level of care. And so I decided to expand access to this type of specialty care outside of academia in the community, without wait lists, really, giving folks the amount of time that they need to spend with a mental health provider and work with them for as long as they need to work with me to develop a treatment plan to improve their quality of life. So that's kind of my niche uh, in this care, is really helping with the quality of life of of folks who are experiencing mental health challenges.
Awesome. And we'll get into some of those. So I looked at your website and some of the materials you have out there. I actually put um, how you describe the differences in the care that you provide in social media, so that our folks could be anticipating this episode. So I like how you said, it's holistic mental health services. You're in your community coordinating meetings with oncology, palliative care, and hospice providers. And also how you are helping with the whole spectrum of the disease process. And so that's what I want to jump into. So let's just go to our story for today. I recently was in the interdisciplinary team meeting. As my listeners know, hospice and palliative, that's baseline for us. That's how we do our work. We provide care to patients and families in a team-based approach. And so one of the nurses, actually a new nurse that I met, she said, she shared how she used to be an oncology nurse before she came into hospice. Everyone was going around the table answering the question for me, how did you know hospice was your jam?
Mhm.
Because everyone has a story and how they came to this specialty. And so she said she did oncology, and she talked about how it was depressing for her as a nurse. And she went on to say how she felt more like a nurse when she started practicing hospice care. And I was like blown away. And
Yeah.
I shared that kind of feeling depressed idea with her because when I was in residency on my oncology rotation, knowing that I wanted to get into palliative and hospice, I even felt that same weight and the vibe there. Like something was missing there.
Mhm.
And I think that's why I'm so happy to talk to you because I think you're the missing piece. Because, when folks hear the C word, sometimes I don't even say it, that's an initial trauma that they have even if it's
Mhm.
something that's just being worked up, they're like, oh my gosh, like their mind just goes on this topsy turvy frenzy. And they're not understanding what we know. Like, okay, we see
Right.
something, we need to work it up, we need to stage it, we need to do this. It may be nothing, but that individual is already being traumatized and having their psyche affected. So
Mhm.
talk to me about that because I think that's where it starts when they get
Yeah.
the news.
Yeah, no, there are really common periods of like significant challenge or where distress can arise, right? So we think of the initial diagnosis, but what you're describing is even the pre-diagnosis, where maybe there's a lump or something that needs to be biopsied, and then we have this anticipatory anxiety. And some people think that like the challenge of coping with cancer is a one-time occurrence, but there's different aspects along the journey where these challenges or more distress can arise. So there's the initial diagnosis, there's active treatment and different parts of the active treatment, whether that's surgery, radiation, or chemotherapy. And there's post-treatment. So there's symptoms that arise post-treatment like fatigue. And even remission and survivorship offers its own unique period of time where people are learning to cope with, okay, what is this new identity? People have um, a preconceived notion of how somebody should respond when their cancer is in remission or now they're a survivor. But often I've actually seen that it can be a pretty significant time of challenge and redefining who somebody is in their life. So yes, the periods of distress can arise at any given time. And distress is an important word, I think, that comes up in cancer care. And it's actually something that is screened for or should be screened for by oncology providers and or palliative care providers. Because this level of distress, and there's different measures that ways that folks measure it. But it so people end up having less distress either when they feel like the demands of their diagnosis and treatment are low or the amount of support they get is high. And so where I can play a role and where a lot of us can play a role as providers is that support piece. So how do we increase this level of perceived support that somebody is getting along these different, phases of the cancer journey from pre-diagnosis through either survivorship, but also, sometimes through hospice care and towards end of life. Um,
That's good. I've seen so much, and I like how we can kind of lay out the whole timeline for people. So that's pre-diagnosis, like you're saying, then while they're getting treatment, and then we go into a crossroads, right? Some people respond to treatment, and some people don't. Some people may have the cancer diagnosed at a late stage, and so treatment is not available.
Mhm.
And some people get it at an early stage, and then they're able to, recover. Um, I had a recent situation. I can't obviously get into any details, but it was a friend, two friends. They knew each other from a cancer support group, and one, had it was young. They were both young. One was diagnosed stage one, the other stage four. Been dealing with it for years, and that person, has since died. So I've been thinking about that friend left behind, her, whatever her guilt is from, having that different road, and just having to relive that. We wear this pink during October. The NFL has their, initiative of Crucial Catch. You have people, posting their photos and their pink with the boxing gloves, the battle language, and things like that. There's a
Mhm.
lot of mixed messages, that I want to unpack. I'm in a hospice group online, and I saw someone say, my dad lost his battle, and I'm thinking,
Mm.
oh, like he's not a loser. That's how I feel.
Oh yeah, the language
So
we use.
yeah, so could we talk about some? I know I said a lot, but it's just like so many messages out there. How
Yeah.
how can we?
Hmm.
Let's just talk about that.
Yeah, no, the language we use is important. I like how you brought that up, like kind of losing the battle to kids. That does evoke a lot of strong emotions. And then kind of coming back to this like survivor guilt piece. I mean, there is this whole aspect of like medical trauma, right? That we screen for and we look for, but sometimes can be missed because it's not, we don't usually see medical interventions as trauma or traumatic events, because the outcome is supposed to, lead to positive, life-saving or life-prolonging treatments. But the medical trauma itself can be something that still like leads to distress. And like you said, like some of these things can be triggering for folks, and can lead to a whole host of emotions that might then like start to impair their ability to function day to day. Yeah, there's a whole host of like wide range of normal emotions that can come up, but sometimes, um, and I don't like to pathologize. That's something I'm really careful about, like not pathologizing what is normal worry, what is normal anxiety, what is normal sadness, disappointment versus what is something that is impacting someone's level of functioning or quality of life. I feel like I went on a tangent there.
No, you
Um,
didn't. It's good for people to know that sometimes we're humans. Well, not sometimes we're humans. We are human beings,
yeah,
and we can have a wide spectrum of emotions. We can even experience two emotions at the same time,
yeah.
right? And I think I want to deal with patients here, and maybe some family members are here. Maybe this will help them relate to their person better. Sometimes people are uncomfortable in these spaces, so that's how you and I help. We're just having an honest conversation about the things that that person is dealing with, and that's where they can have their healing. That's where they can, express their wishes. But many times their own husbands, wives, their children, their best friends don't even know how to talk to them, and they're uncomfortable, and they are dealing with their own mortality when they're supposed to be
Hmm.
supporting the individual. So even
Yeah,
doctors, I got to put us on the spot too,
I
right?
know. I know.
When we're waiting to, refer our patients, or we're sad, to refer them to hospice or palliative care, we're actually not allowing them to have the full spectrum of care that they should have, and give them time to adjust to it. So that's what I'm excited. Why I'm excited to chat with you, because this
Mhm.
can open the door and open everyone's eyes to what's possible. And so
Yeah.
maybe we can prevent some of that medical trauma, and maybe we can, you know, multiply people like you.
Yeah, yeah, it's incredible. It can be really lonely when you have a serious medical illness, not just cancer, right? But any like serious medical thing going on. And then to add, mental health challenges on top of an already very like lonely or isolating experience, they can compound each other, right? So my goal is just to help people feel less alone as they navigate their like mental health treatment and medical treatment, um, and try to link it so that the two are not siloed from each other, so that oncology and hospice and palliative care, psychiatry, social work, we're all talking to each other about and how do we provide the best holistic care for folks. So
Hmm.
that,
Well,
yeah.
good. Since this is Breast Cancer Awareness Month, I'll just deal with the women here. It's almost time for my mammogram. So, do you find that you have more women who seek care from you than men?
Yes, absolutely. I Women and younger women. I think having a diagnosis when you're young also is like adds an extra layer. I mean, the diagnosis can be significant and distressing no matter when, but I would say young and young women um, who have cancer are typically the ones that are finding me. Mhm.
Mm-hmm. All right. Well, if they don't live in the Bay Area, how can someone seek your type of care? What's the
Mhm.
best way for them to do that?
Yeah, so I'm able to see folks in all of California. So they can reach out to me certainly. But then also they're usually so where their oncologists could help them find out are there psycho-oncology services nearby. And again, usually they are at like academic institutions. And I know usually that's where a lot of folks do get their like oncology or palliative care. So usually there is someone who can link them with services there. They could also go to psychologytoday.com and type in the type of care they're looking for. So if you type in cancer psychiatry or psycho-oncology, for a psychiatrist, but then even for a psychologist, if so psychologists, they tend to do a little bit more psychotherapy, and psychiatrists can do the full comprehensive evaluation if you need medications. But if you go to Psychology Today, you can usually put in some of those keywords and the zip code, and folks will pop up in that way as well. My goal too is to kind of help people find these services because I don't think it's often as transparent as it should be. It feels very nebulous, and sometimes it surprises me that people don't know what psycho-oncology is or what psycho-oncology services are. So I guess it's part of my mission to educate about how to find these services too, because now it feels very dependent on where people are located.
That's fantastic. And I'll for sure put a link to psychiatry today or psychology today. Look,
It's
I need to pay
Psychology
attention.
Today. Yeah,
Yeah, we'll
Psychology
put that
Today.
in. Hmm.
Mhm.
I'll put that in the show notes, and we'll definitely have your website in the show notes. And it's good to know that people in California can get care from you. So that's checking off my state there. And
Mhm.
then the others will have a way to connect. I appreciate that. Now, I know we're going to have a lot of questions from this, but did you have any other things that you wanted to make sure we covered before we let the people go and look at these links?
Um, No, I didn't know if you wanted to talk about like end of life option act evaluations, which are also part of something that I do and offer.
Oh yeah. Yeah, of course. So what do you want to say about it?
No, I did so end of life option act for folks who don't know about it. It's an option for folks who do have a terminal illness. I believe the eligibility criteria are similar to when you're eligible for hospice, but it's, and it's an option for some people who kind of want to feel a little bit more empowered towards the end of their life if it is something that they're interested in. And sometimes, but not always, psychiatric evaluations are necessary to move forward with it. But if people do have questions or want to talk more about it, they can feel free to reach out to me, and I'm happy to consult and and give more information about it.
Yeah, so in California, for the full spectrum of end of life care, California has provided um, a means for people to exercise their medical aid in dying. And so that's called the End of Life Op- Option Act,
Yeah, we call
ELOA.
it
E
EOLOA.
EOLA. I get all tongue tied with that. So sometimes there's specific criteria from the California Department of Public Health where people are required to have evaluations by two physicians. Uncertain about the criteria in other states since I don't practice there, but that is something. So you're saying you help with those evaluations as well.
Mhm.
Hmm. Now, would that be for people in the entire country or only in California?
Currently only in California.
Okay, okay. Yeah, well, that's good to know. I'll also put a link to that in the show notes because some people do want more information about that. And it's not something that's, so openly accepted. And so that's public information on the website for the California Department of Public Health. And you can get that information if you're so interested in that. So I appreciate you coming here and shedding light on psycho-oncology and helping us know that first of all, just acknowledging the medical trauma and the emotions and the things that people deal with when when they have cancer diagnosis and through their treatment survivorship and sometimes not surviving. There's just a wide range of care that people can benefit from, and you shed light on that. So I thank you for being on the show today.
So much. Yeah, thank you so much for having me.
Yeah. All right, everyone. If you have any questions, you know how to send them on the website and respond to the poll on Spotify. This is again a bonus episode for Breast Cancer Awareness Month. If you have any suggestions for other topics, you know how to give it to me. So peace, everyone. Thanks, Dr. Drolet.
Thank you. Thank you, Dr. G.
So, Dr. Drolet, so how do you know my coach, Dr. Beckford?
I met Dr. Beckford recently through there's Entre MD Business School.
Oh,
So
okay.
I connected with her there. So I'm kind of using that to help build this brand, build the awareness of my private practice. And so I was able to connect with Dr. Beckford there.
That's
And
good.
she
Yeah.
was like, I know this wonderful physician who's in hospice care in California. Let me connect you. Um, and so here we are. Thank you, by the way, for connecting with me.
Oh, oh,
I'm
no
so
worries. Like,
excited. Yeah.
yeah, like she helped me so much. She did her coaching and her You Are Caring Doc Society. And 2022 was
Mhm.
the self-care year where she got me together. I feel like I recovered from the pandemic with her. And so I'm so grateful to her. Shout out to you, Dr. Beckford. That's how
Yes.
we have our mutual connection. And you and I have so much in common, being moms. I saw that you also went to medical school or did some of your training with children, your mother of three, your
Yes.
husband's in IT, right? So we have
Yeah.
all this stuff in common. And I saw that you mentioned about Motherhood and medicine don't mix. And I don't want to get too deep off into a rabbit trail. I actually want to celebrate womanhood since this is Breast Cancer Awareness Month and we are wearing our pink.
Yeah.
And I do believe that women, we can do anything and we are the ones who are going to advocate and fix the things going on in our healthcare system. Just
Yeah.
this Saturday, I was at the Alzheimer's walk with ABWP, the Association of Black Women Physicians. So we are doing a lot, to try to fix things. And I applaud you for being out here spreading the word on your specialty. So, how are
Thank
you
you.
managing your welcome motherhood and all that stuff?
Yeah. So motherhood and medicine don't mix. The title of that was not meant to be too controversial. If you keep reading it, it says unless you advocate for what you need.
Mm,
Um, so if you advocate for what you need, I think motherhood and medicine can mix. But you have to be clear about what you need as a mom, as a woman in medicine, because it wasn't built for us originally. So it's
mm,
almost like being left-handed and being forced to be in like a right-handed world, right? Like there's nothing wrong with being left-handed, but you feel like you have to adapt, but maybe the system can adapt for us by advocate because people won't know what we need, right? Initially, when I entered medical school, my son was 2. He was my first, and I was the only mom in my class. And for a while, I felt like I had to hide that I was a mom in medicine, and not share it with my attendings or those that I was training with because it felt like it would be seen as a weakness or like perceived as a weakness rather than a strength. And it wasn't until much later in my training, after I had my second child and then my third child, and then the pandemic happened, that I was like, I'm going to burn out and leave medicine if I don't begin to advocate for what I need. And surprisingly, very few times that I hear no. It was more often than not well received. I know I'm in psychiatry, so those of us in psychiatry are supposed to be a little bit more understanding. Um, but I was surprised by how often I heard yes. How can we help you succeed? Because most people do want to help you succeed, but they don't know how. If you're waiting for someone to jump in and fix it, it might not be fixed. And so part of a side passion is helping women and mom physicians advocate for what they need. Um, it's not easy to do, and it's like any other skill, a muscle that you learn to use, and um, that's how I am, where I am today.
that's good. And that's a good segue. So, with this information that you have provided the listeners of this podcast, they can go advocate for themselves. And that's why I
Yes.
have this show. So they can go say, hey, why haven't you talked to me about hospice care, doctor? This book over my shoulder that's on pre-order right now. It's set up so that people know what the trajectory is going to be. And if they don't know, how can we start the conversation, right? How can you advocate for yourself if you're waiting for someone to tell you when it's time?
Right.
You should
Right.
know when it's time yourself, and you should know what to ask for. So now you all know that you can ask for a psycho-oncologist so that you can be supported through your cancer journey, through your treatment, your pre-diagnosis, your diagnosis, and all that stuff. You're going to need help, you're going to need support, and that
Mhm.
specialty is here. So thank you for joining me, and we will continue to talk about this.